Good evening and welcome to RFL. I'm Richard French. Well, tonight, you, our viewers, be a big part of our program. We are joined by an emergency room doctor, and he is ready to take your questions about COVID. Phone lines are open, and if form holds, they will fill up quickly. A lot of people with questions, and you have the perfect person here to help you get some answers. 888-766-2428 is our toll-free number. And also, obviously, there's a lot of news to get to as well with COVID. I also want to remind you, you can make your opinion heard online as well. Email us your thoughts and questions. You can send them to rfl@rnntv.com. Now, before we get to your reaction, I want to give you the latest on the outbreak. President, he is visiting a Honeywell factory in Arizona as we speak that is making masks. Whether he'll wear one or not is a different question, but this is the longest trip the president has taken since the outbreak has flared up. Now, before he did leave, the president, he spoke from the White House lawn, and once again, he made this pitch when it comes to reopening the country.
If they held people any longer with the shutdowns, and you're going to lose people that way too, and you already have, I'm sure. But between drug abuse and, they say suicide, a lot of different things.
Those comments came right on the heels of a disturbing new report showing that we could be in for another spike in deaths, not this fall or winter, but picking up at the end of this month. And I'm talking 3 weeks from now. The CDC is projecting a surge in the fatality rate, and not a marginal one. According to internal documents obtained by the New York Times, top health officials in this administration say we could see 3,000 deaths per day by the end of May. That nearly doubles the rate that we've been experiencing so far. The president was asked about that report this morning, and this is what he had to say. And remember, this report coming from his own administration.
That assumes no mitigation, and we're going to have mitigation. No, we're letting people out, but the fact that we're letting people go and go to their jobs, they have to do it.
Okay, let's do a fact check here. The report here from the CDC does in fact take mitigation into account. Also, a different model that the White House has often referred to is also projecting a much higher death toll. Researchers at the University of Washington now say we could see 134,000 deaths by August. That report says easing up of social distancing in many states will largely fuel that spike. Now, despite all of that, multiple reports say, I want you to think about this, with everything I just reported here, that the administration, particularly the president, is looking to wind down the coronavirus task force. A senior White House official told CNN it will be phased out by Memorial Day, but key medical experts will continue to advise the president on a daily basis. But I wouldn't hold your breath that they will get FaceTime. Dr. Anthony Fauci, obviously probably the most prominent member of that task force. President Trump has confirmed the doctor and other health officials will testify before a Senate committee a week from today, but Trump said he will not let Fauci appear before the House of Representatives because Democrats control it, and he claims they hate Trump. Now, the president also said a lot of inflammatory things about the Democrats, and we'll discuss all that in politics a little bit later on in the program. Now, speaking of Dr. Fauci, he also gave this grave warning about reopening too soon and the trade-offs involved.
It's the balance of something that's a very difficult choice, like how many deaths and how much suffering are you willing to accept to get back to what you want to be some form of normality sooner rather than later.
So that impossible trade-off that's being asked to be made here, you heard the doctor touch on it, but Christie, he did go there. He made these comments about reopening on a podcast called Daily DC. Take a listen to the former New Jersey governor making a comparison that, I'll speak for myself, is more than a stretch.
Of course, everybody wants to save every life they can. But the question is, towards what end ultimately? Are there ways that we can thread the middle here to allow that there are going to be deaths, and they're going to be deaths no matter what? These are the decisions that governors are facing now, and they can't be timid. We are being faced right now in some of the states with paralyzing timidity rather than Churchillian boldness.
A reminder here before I bring in my guest, and our phone lines are open right now at 888-766-2428. I want to bring in my guest right now. And again, he'll be taking your reaction as well with me. You see the toll-free number right there at the bottom of your screen. Dr. Felipe Serrano is an emergency room physician with the Mount Sinai system. He's also an assistant professor of emergency medicine. I actually had some questions I was going to get to a little bit later about how you have to navigate the Hippocratic Oath with end-of-life care decisions that you guys have been confronted with for well over a month now. But what Governor Christie casually said about what's, basically your stomach for this, he was talking about Churchillian. They were in a world war. They didn't have a choice. The enemy wasn't asking them or giving them options to stay in the house or not, So when the Blitzkrieg was going on, your life was in your hands if you were in your apartment. We all want to come out. But I just get this sense, and I'm hardly alone, doctor, that the medical professionals are saying it's too soon. We're just not ready yet. Every indicator, and fatalities being the clearest one, but the spikes in terms of positive cases, et cetera, they're going way up. And while the public showed some patience, in some cases they're being egged on to not use protective gear, not to put on masks, not to practice social distancing. And it's a witch's brew as a consequence, isn't it?
I think the problem is that we don't have enough information or enough resources to know whether it's too soon or not, right? If we had had enough widespread testing, or if we had the ability to track cases like we should have as a country, then we could say with more certainty, this is okay to open now, or we got to wait another month, or this is what's going on. The problem right now is that we don't have information. And so in the situation of not knowing how many people have been infected or how many people have actually died, we don't even know that number. As the medical profession, sort of our recommendation is, if we don't know, the safest thing to do is to stay at home right now.
And to me, I understand the frustration. I do. And the economic consequences cannot be exaggerated how terrible they are. But if you're going to go out and you're not even going to be putting on a mask, and again, putting on a mask or not putting on a mask is not some sign of courage. You're putting on a mask because you believe in a social compact, that you care not just about your own health, but the health of someone else. Putting on a mask is not, if I have something, I'm giving it to you if we're not socially distancing. So to me, doctor, even that small sacrifice is being considered a bridge too far. That's what gives me so much concern here as people start going out and then businesses started reopening and everything else. We're not even taking that minimal precaution. And if we can't do that, my God, I think what's going to start coming back through your ER doors.
Yeah, you make a really good point there, and that's the fact that we wear a mask, especially these surgical masks or the cloth masks, not really to protect yourself, right? You're not going to prevent getting coronavirus on yourself by wearing a cloth mask. What you're doing and what we recommend you wear a cloth mask for is in case you have coronavirus, you're avoiding passing it to other people. And as we know now, there are many, many, many asymptomatic people with coronavirus, people who have zero symptoms at all, no cough, no fever, no shortness of breath, who are testing positive, who are able to give it to patients. I had just this past week an 82-year-old man. He had sat at home for 50 days with just his son. Nobody had come in the house. Nobody had left the house. I don't know if it was a package. I don't know if it was groceries, but he was in the emergency room last week with coronavirus, and he was very, very, very ill. So we don't know enough of how this virus is passed on. And so if the bare minimum you can do is wear, I admit, uncomfortable mask, then please do for the protection of others.
And this point was echoed. Governor Cuomo, as recently as this morning, spoke about that issue, about the idea of at least wear a mask.
Wear a mask. Wear a mask. I mean, that's the basic step, right? You want to honor the healthcare workers and the people who literally gave their lives in some cases for what they did here. Act responsibly. Wear a mask.
And I think of yourself and the other frontline healthcare workers who not only what you guys have done, but also how generous you are that you spend your time with us, and we're going to be getting to phone calls shortly. But one doctor, also from New York City, a Dr. Gilliam, he penned a piece, because this weekend was beautiful in New York for those of you watching us from other parts of this country. And we've had a lot of crummy weather days, but Saturday was gorgeous, and Central Park was not surprisingly busy. But from his viewpoint and from what he said the following, quote, "It's a slap in the face," talking about how congested the park was, how people forget about masks, they weren't even socially distancing. He said, "It really is. I can't explain it. What they're doing is very selfish and not in touch with reality." And I'm curious, Doctor, if you had any of those same kind of feelings this weekend where you understood the human nature. You know, we've been separated for so long, or it feels so long, and finally, there's sun. You want to get out. But when you see crowds like this, do you see, oh, well, I'm going to have a busy, a couple days from now, some of these same people are going to be coming into my ER?
Yeah, and it's frustrating for sure. And it's okay to go out if it's a beautiful day outside, right? It's okay to venture out to the parks or walk around, but just wear a mask, right? Keep your distance. If you're going to go see friends, sit a little bit apart from the people that you haven't seen in a long time so you don't give them the infection. It's sometimes a little frustrating seeing this happen on the weekends, and then these are the same people who are clapping at 7 p.m. for their healthcare heroes. It's a little bit of a dichotomy of, we celebrate what you're doing, but yet we're going to do what we want otherwise.
And I get it, it's the human condition. We all want those closest to us and human contact, but I have a kid graduating high school, and the amount of families that are livid that there won't be a graduation held, and I'm like, what planet are you on? Like, how irresponsible would it be for a school to bring all these kids together, right? If our first love is for our families, like, why would we take an unnecessary, and that's what this is coming down. What is the calculation? And while it's individual in nature, what people are willing to do and not do, it's also collective consequence. That if people don't do this, like I saw in Michigan, where in the State House, people with assault weapons are on there, and these poor police are there with the face masks, and people are screaming, all but like spitting in their faces here, because the governor is trying to keep the citizens safe. It's a confusing time in this country. All right, we're going to take a quick break. I know the phone line's jammed right now. We come back and we go straight to the doctor, and he's here to answer your phone calls and your questions and your emails, and put it out here for him. I know we've got a lot of mixed information about where we are with this virus right now. Here's your opportunity to get some answers. See the toll-free number, 888-766-2428. We'll be right back.